Okay, good morning, everybody, once again. Now we are going to start. So, if you remember last lecture, we completed the general physiology and we started respiratory system. Okay, so today we are going to continue respiratory system and I will try to see your messages in between. If there is anything important, you can write and I will try to answer. Also, every time I will ask you for attendance, you have to, in 2 minutes, you have to send your name and group number. Okay. So, for example, if your name is Rahul, you will write Rahul group 1 and you will send the comment. Okay. So, not one time. I will ask for attendance many times because some students they join the lecture and then they fall asleep or they stop watching the lecture in between, so I don't want that. Okay, so as many times as I want, I will ask for attendance. When I will ask, you have to send your name and group number. So now let's start the lecture. So if you remember, I asked you to get the answer for this question: what is Achilles heel of the respiratory system? So if anybody knows the answer, you can write in the comment. After that, I will tell you the correct answer. So quickly, please. First of all, you have to know what is Achilles heel. Only then you can answer what is Achilles heel of the respiratory system. See, this is the problem, my dear students. You don't listen what I'm saying. I did not ask for attendance right now. When I will ask, then you have to send. Okay? So please always listen. Listen like a doctor. Okay? So your patient will tell you, I'm having pain in my right hand. You will start treating his left hand. No, you have to listen carefully. Okay? Okay, I got one correct answer for Achilles heel and it is straight from Google. So very good. Mm-hmm. But the answer is correct. So well done. Okay. So let me tell you what is Achilles heel. See, in anatomy, you must have studied about this Achilles tendon. Okay. Achilles tendon. So this Achilles tendon, if there is some inflammation of this tendon, then it will become very weak and it can become damaged. Okay. So it is a weak part of the leg, which means it can be damaged, it can be hurt. So anything which can be easily damaged or hurt, it is called Achilles heel. Okay. So it means the weakest part of something. So for example, if I have this device, if I have this remote, okay, and this part can easily break. Okay, so there is a part, now it's not breaking. So if this part can easily break, I will call it the Achilles heel of this remote. Okay, so similarly, what is the Achilles heel of the respiratory system? It means which is the weakest part of the respiratory system. So the answer will be the last six generations. Okay. So the last six, the bottom six generations of the respiratory system are Achilles heel. Now the question is, Why these are called Achilles heel? So let me take you once again to the structure of the lungs. What is the structure? See, inside the lungs, what you will see is that, these are the pneumocytes type 1, pneumocytes type 2. And in the cells, if you can see the pointer, just follow the pointer. These things are called cilia. Okay, they are finger like structures. So tiny finger like structures are present in our respiratory tract. Please stop sending your attendance. Okay, just listen to the lecture. Right, just give me a second, I need to adjust the presentation. How about this? Okay, now you will be able to see better. So talking about the Achilles heel of the respiratory system. Yes. Okay. So in the lungs, we have the cells, and on these cells, we have these cilia are tiny finger like projections. What happens if you inhale some foreign object, if you inhale some dust, these cilia will move and they will remove the substance from your respiratory system. But in the bottom 6 generations, in the last 6 generations, this cilia is function is not present, so in such a perfect way. Okay, so they are not effective in the last 6 generations. That's why the last 6 generations are called the Achilles heel, because if some foreign particle, if some dust, or if any substance goes into the bottom 6 part of the lungs, then the lungs cannot remove it. Okay, so it is technically we say that the mucociliary clearance is weakest. Okay, all right. So the mucociliary clearance will be less, which means that if a substance goes to these bottom regions of the lung, they cannot be removed by the cilia. Okay, so that means this is the weakest part of the lungs. Now let's come to the next topic, which is the mechanics of breathing. So we all know about breathing, right? You take breath in and you exhale out, but how does it happen? Which muscles are involved in this? So does anybody know the muscles involved in breathing? Can you please write the muscles? And by the way, some people pronounce it as Achilles heel, but I just checked the correct pronunciation. Correct pronunciation will be Achilles heel. Okay, Achilles heel. So this is not important. The pronunciation is not important for your exams, but as doctors, you should know about it. Achilles. Okay, Achilles heel. All right. Mechanics of breathing. So diaphragm, costal muscles, pulmonary muscles. What are the pulmonary muscles? Pulmonary is lung. So which muscles are present in the lung? I don't know. Diaphragm and intercostal muscles. Yes. So actually, there are two types of breathing. There is normal quiet breathing, which we are doing right now. See, in quiet breathing, you have to understand one thing. that when we are taking air in, which means when we are inhaling, then we have to use our muscles. Okay. But when we are exhaling, when we are leaving the air out, at that time we don't have to do any work, it will automatically close. Okay. So to take air in, you have to do active work, but to leave the air out, it will happen without any energy. Okay, it will happen on its own. So in normal breathing, inspiration is active, which means when you breathe in, muscles are required to do that. But expiration is passive, which means leaving air out will not require muscle contraction. Okay. All right. Now, muscles used for breathing, as you rightly pointed, diaphragm and the external intercostal muscles. See, right now, what are we talking about? We are talking about the normal, quiet breathing, which means the breathing which you and I are doing right now. Okay. So, this kind of breathing requires the diaphragm and the intercostal muscles. Now, after this, we are going to see forced breathing also. So, the muscles for that will be different. Now, here you can see, if I hope you have studied this in anatomy, this is the diaphragm. Okay. This here is the diaphragm. So, it is at the bottom of the lungs. Okay. So, when the diaphragm contracts, it will come down. Okay, it will come down and it will bring the lungs also down, so the lungs will expand. What about the external intercostal muscles? So intercostal means they are present between the ribs. Okay, intercostal muscles. So these intercostal muscles, what they will do, they will lift the ribs up. Okay, so for example, if these are the ribs, the internal costal muscles will lift them up, and because of that also the lung will expand. So when the lung expands, the air will go into the lungs. uh, Somebody is asking to repeat little bit in Hindi and Urdu. So what we are trying to say is, हम ये बता रहे हैं यहाँ पे कि जो हम सांस लेते हैं नॉर्मल तौर पे, उसमें जब हम सांस अंदर लेते हैं, जिसे हम इंस्पिरेशन कहते हैं, वो एक्टिव होता है, मतलब उसमें हमें एनर्जी लगती है, उसमें हमें मसल्स यूज करने पड़ते हैं। लेकिन जो हम सांस छोड़ते हैं, उसमें हमें मसल्स की ज़रूरत नहीं पड़ती, ठीक है? वो अपने आप होता है। वो कैसे होता है, वो हम बाद में देखेंगे। तो कौन-सी मसल्स की ज़रूरत पड़ रही है? एक होता है डायफ्राम और एक होते हैं एक्सटर्नल इंटरकॉस्टल मसल्स, ओके? एक्सटर्नल। कहाँ पे होते हैं ये मसल्स? मैंने बता दिया, डायफ्राम लंग्स के नीचे होता है, और ये मैंने यहाँ पे भी आई लिख दिया था, दिस इज़ ई। ओके, एक्सटर्नल इंटरकोस्टल मसल्स, एक्सटर्नल इंटरकोस्टल मसल्स। सो एक्सटर्नल इंटरकोस्टल मसल्स क्या करते हैं? रिब्स को इस तरह से उठाएंगे तो लंग का साइज बड़ा हो जाएगा। जब लंग का साइज बड़ा हो जाएगा तो एयर उसके अंदर आ जाएगी, ठीक है? उसी तरह से जो डायफ्राम होता है लंग्स के नीचे होता है, डायफ्राम क्या करता है? डायफ्राम नीचे मूव करता है। जब डायफ्राम नीचे मूव करेगा, उससे भी लंग का साइज एक्सपैंड हो जाएगा। Okay. Now, the opposite action will happen and in exhalation. So you can see inhalation is over here. Let me see if I can change the color. Okay, yes. So this is the inhalation and this is the exhalation. In inhalation, diaphragm is coming down. In exhalation, diaphragm is going up. Okay. Similarly, what about the external intercostal muscles? They are taking the ribs up during inhalation. Okay, so they are taking the lungs up. See, if you breathe yourself, you look at me. So what is happening? My ribs are coming up. Okay, and when I'm releasing, when I'm letting go, my ribs will come down. Okay, so that is what is happening. The opposite action will happen during inhalation and during exhalation. So I hope you all understood. Now, here, I just wanted to show you, because you are going to become doctors, I wanted to show you what X-ray looks like. Okay. So here is your X-ray during exhalation. You see, where is the diaphragm? The diaphragm is here. Let me make it easier. This is the diaphragm. Okay. So, what is this? Exhalation, which means the lungs are small. The lungs are small. Then, what will happen? This diaphragm will move down. Diaphragm will move downwards. So, now you can see the diaphragm has come over here and the lung size has increased. So, because the lung size has increased, the air will go into the lungs. Okay. Right. Students, if you want me to repeat something, then please tell me exactly what you want. Okay. Repeat means it's already been 10 minutes. So, what should I repeat? Okay. So, the mechanics of breathing. The muscles used for breathing, diaphragm, I told you it will go down and it will increase the vertical diameter. So, I hope you all know that this direction is called vertical. Okay. And this direction is called horizontal. Okay. So vertical diameter of the rib cage will increase, which means that these are the ribs. Okay. These are the ribs. So this size will increase with the help of what? With the help of diaphragm. Okay. No, we cannot repeat from the Achilles heel. That after the lecture is over, you can find this video on YouTube and you can watch again. Okay, we cannot repeat the same topic again and again because it is a very long lecture. Okay, now next thing, the second type of muscles, what were they? External intercostal muscles. What they do? They elevate the rib cage. So, like I told you already, this rib cage will be elevated. This rib cage will be elevated. Rib cage जो है वो ऊपर की तरफ जाएगा. ठीक है. So external intercostal muscles elevate the rib cage and this increases the anterior posterior diameter. What is anterior posterior diameter? So if a person is standing like this, I know he looks funny, but if this is the person, okay, yeah, it's very beautiful, man. So this is the person, this is his eye, this is the person's anterior side and this is his posterior side, correct? So by elevating the rib cage we are actually increasing this diameter. Okay, we are increasing this diameter, anterior posterior diameter. Okay, why are we discussing this? So I can ask you in the exam, which muscles increase the vertical diameter? So the answer will be diaphragm. And which muscles increase the anterior posterior diameter? So the answer will be external intercostal muscles. Okay. All right. Now, just going back to anatomy a little bit before we continue, you all know that you can divide the upper body into thorax and abdomen, right? So now please tell me, we saw that there are two muscles involved in normal quiet breathing. So the two muscles are diaphragm and external intercostal muscles. So between thorax and abdomen, which muscle is present in thorax and which muscle is present in abdomen? Can you please answer this quickly? First, yes, diaphragm in the abdomen and intercostal in the thorax. Yes, very good. So now there is a difference in the breathing of males and females. So we have to know, in males, most of the breathing is contributed by diaphragm. So the males, they use their diaphragm for breathing more as compared to females. So that's why in males the breathing will be called abdominothoracic. Abdominothoracic. See, abdomen has the diaphragm, thorax has the intercostal muscles. So if abdomen is being used more, so we call it, I mean, if diaphragm is being used more, we call it abdominothoracic. ठीक है, नाम में पहले abdomino आ गया. Abdomen will come first in the name, abdominothoracic. What about females? In females, the diaphragm is restricted, but the intercostal muscles are stronger than men. So, in females, the breathing will be called thoraco-abdominal breathing. Thoraco-abdominal. So, in males, abdominothoracic. In females, thoraco-abdominal. Why? Because females use intercostal muscles more effectively, and males they use the diaphragm more effectively. So what could be the reason behind this? Can you think of the reason and quickly guess in the chat what could be the reason? Why in females the diaphragm is restricted? What is the reason? Is there any use? Come on, if you want to guess, then guess quickly so that we can move on to the next slide. No, so far the answers are not correct. Any other guess? Okay, just take a minute, think about it, and I will be back. Okay, just 1 minute. Okay, few students have tried, but unfortunately that's not the correct answer. But it's okay. Well done. You should try even if your answer is not correct. Yes, I got the correct answer. The correct answer is pregnancy. Okay, so in females they have one extra organ, which is the uterus. Okay, so the uterus, it expands during the pregnancy. So because the uterus is expanding, what did I say, the diaphragm has to come down. So if the uterus has expanded during pregnancy, the diaphragm will not be able to come down freely, right? So that's why in females the intercostal muscles are stronger, so that they can continue breathing effectively even during pregnancy. Okay, so that is the reason. Now we are going to see the accessory muscles. So right now we saw only two muscles, the external intercostal and the diaphragm, but these are used during normal breathing. What about forced breathing? So forced breathing, what does it mean? I'm going to show you examples. Forced breathing का क्या मतलब होता है? Before that, let's just look at the names of the muscles, and these names of the muscles you just have to memorize. If you don't know where these muscles are present, then you should go and open your anatomy textbooks and you should look again. If you don't want to open your anatomy textbook, you should at least go to Google and you should write the names of these muscles and you should see what is their location. So ala nasai, these muscles are present in the nose, serratus anterior, scalenii muscles, and sternocleidomastoid. So these are your important accessory muscles. Accessory muscles means these are used for forced breathing. And also we have the abdominal muscles and internal intercostal muscles. Please pay attention. This one is internal intercostal muscles. In normal breathing, we were using external intercostal muscles. Now we are using internal intercostal muscles. And the special thing is that these two, the abdominal muscles and the internal intercostal muscles, these are used for forceful expiration, expiration or expiration. Okay. So these are used for inspiration, and these two are used for expiration or expiration. Do you understand? Now, I hope I don't have to tell you that inspiration means to inhale, inhale. This is inspiration. And expiration means to exhale. Okay. All right. Just to make it clear, inspiration is inhalation and expiration means exhalation. All right. Next, what is the movement of the thoracic cage in breathing? So we are talking about the thorax, right? The lungs are inside the thoracic cage. So the ribs and the sternum and the vertebra, they make like a cage, right? So during breathing, what kind of movement can we see? What kind of movement? So there are two types of movements. One is the bucket handle movement, and the second is the pump handle movement. What does it mean? See, bucket handle movement means, where's my, yeah. So you see, this is a bucket, okay? And buckets have handles, right? So this is the handle of the bucket. So what will be the movement of this handle? It will move back and forth, right? Like this, in this direction. So that is the bucket handle movement. What about the pump handle movement? See, this pump refers to those pumps which are in the ground. Okay. So you must have seen there are these types of pumps. Yeah, there was an image there. So there are these type of pumps which, if, see, this handle will move up and down, and there will be water from the ground. Okay, so this is the pump handle movement. So where do we see these two types of movements? About that we are going to discuss. See, the pump handle movement, it refers to the movement of the ribs, the elevation of the ribs. Okay, so just now I told you that the ribs, they get elevated, right? So these are the ribs, and this is the sternum, these are the ribs. What did I tell you? The ribs are moving up and down, correct? So this movement is called the pump handle movement, okay? Because the ribs are moving like a pump handle. And what about the bucket handle? See, this causes, this is also the elevation of ribs, but this is the sideways movement, okay? This is the movement in this direction. So if you are looking anteriorly, so the bucket, the ribs, I'm saying the buckets, the ribs are moving in the way the bucket handle moves. Okay, so this handle, if you can see over here, this handle moves like this, right? It moves like this and it moves like this. So similarly, the ribs, when you look at it from this angle, they will move in this direction. And on the other hand, if you look from the side, if you look from the side, then what is happening? The movement, actually the movement of the sternum is considered here. So the sternum, if you see the movement of the ribs in relation to the sternum, so the sternum will take the ribs up and down like a pump handle in this direction. Okay. All right. So once again, just to clear any confusion, pump handle movement, you see it from the side. Okay. You see it from the side, and it is because of the movement of the sternum. So the way ribs will move because of the sternum. This is the pump handle movement. And if you look from the front, you can see the ribs will go like this and like this, and they will come back also like this and like this. So this will be your bucket handle movement. Okay. All right. Now we come to the next thing, which is the pressures involved in breathing. So in our lungs, there are different types of pressures. So pressure is actually related to force. Okay. Now I can see the number of students is increasing and decreasing. So everybody now please send your name and group number for the attendance. And again, I like I told you, I will take the attendance 2 or 3 times. So don't leave after writing your name. You have to stay here. Okay. So just your name and group number. Okay. Let's continue now. And please stay online. Again, I can ask for attendance. And if you don't send the attendance within 2 minutes, I will mark absent. So your name should be present in all the times that I ask for attendance. Okay. Not just once or twice. Okay, so pressures involved in breathing. Let's quickly do this. So the first pressure that is involved that we need to know about is intrathoracic pressure, which is also known as, whenever you see this AKA, it means also known as intrapleural pressure. So what is the meaning of this intrapleural pressure? It is the pressure between the two pleura. So what is pleura? See, please look at this. This inside structure is the lung. Okay, so you can see it is the lung, and just outside the lung we have a covering which is known as pleura. Okay, now the pleura itself has two layers. So there is parietal pleura, which means the outside layer, and we have the visceral pleura, which means the inside layer. And between these two layers we have the pleural cavity. Okay, pleural cavity. Cavity means gap. So this gap is not empty. There is a liquid present in this gap. It is known as the pleural fluid. Okay, so this gap is known as the pleural fluid. So where is it present? It is present between the parietal pleura and the visceral pleura, pleural fluid. Now with that concept, let's move forward. So there is a pressure between these two pleura, and that pressure is known as intrapleural pressure, and this pressure is mostly negative. It is negative pressure. So what does it mean? See, if you have ever tried to use a syringe, okay, the one which we use to give injections. So if you try to pull on that, you are actually creating negative pressure. You are creating negative pressure. So what will happen? Because of the negative pressure, the syringe will pull the drug into the syringe. ओके, लेट मी एक्सप्लेन इन हिंदी वन टाइम. हम क्या कह रहे हैं कि लंग के अराउंड जो है लेयर होती है जिसका नाम होता है प्लूरा. और प्लूरा में भी दो लेयर होती हैं. अंदर वाली लेयर को विसरल प्लूरा बोलते हैं, बाहर वाले को पेराइटल प्लूरा बोलते हैं. और इनके बीच में होता है प्लूरल फ्लूइड. ठीक है. और इसका जो प्रेशर होता है उसे बोलते हैं हम इंट्रा प्लूरल प्रेशर. और ये प्रेशर हमेशा नेगेटिव होता है. तो नेगेटिव प्रेशर का क्या मतलब? नेगेटिव प्रेशर का मतलब ये कि जैसे अगर आप कभी इंजेक्शन में जब दवा डालते हैं, तो जब आप उसको पुल करते हैं, तो वो आप क्या कर रहे हो? आप एक नेगेटिव प्रेशर क्रिएट कर रहे हो. नेगेटिव प्रेशर की वजह से क्या होगा? वो मेडिसिन उस इंजेक्शन के अंदर पुल हो जाती है. ठीक है. सो दैट इज व्हाट वी मीन बाय नेगेटिव प्रेशर. ओके, आई होप यू अंडरस्टूड. सो व्हाई डू वी नीड दिस नेगेटिव प्रेशर? ये इंट्रा प्लूरल प्रेशर जो है इसको नेगेटिव प्रेशर क्यों करना है? वो इसलिए बिकॉज द लंग्स, दे आर लाइक they are like a balloon. Okay, so the lungs, they always want to close. The lungs always want to be closed. So to keep them open, we don't want the lungs to close, otherwise the lungs will collapse, right? So we want to keep the lungs open. That's why we need this negative pressure, so it will keep the lungs open. Okay. Right. Now, one more thing you have to remember, we are going to this concept will help you understand later on some other thing. The parietal pleura, which means the outside pleura, you can say that it is attached to the thoracic wall. Okay, so this is the thoracic wall. What is the thoracic wall made of? It is made of ribs and intercostal muscles. So this thoracic wall, you can say that the parietal pleura is stuck with the thoracic wall. And what about the visceral pleura? Which means, what about this inside pleura? The inside pleura is stuck with the lungs. Okay, it is stuck with the lungs. So just remember this. We are going to use this understanding in some other concepts. So I told you the negative pressure helps keep the lungs expanded. Okay, what's next? Otherwise, lungs have a tendency to recoil and collapse. Okay, what is the meaning of tendency? It means the lung wants to close, the lung wants to collapse, but we keep it open with the help of this intrapleural pressure. Okay. And what is the cause of this negative pressure? Why this negative pressure exists? So the cause itself is the elastic recoil tendency. Okay, the cause of this negative pressure is the tendency of the lung to recoil. So let's again talk about the pleural fluid. Pleural fluid is the small amount of fluid present between the pleura. Okay, parietal layer, the layer outside, it secretes the pleural fluid, and the visceral layer, it absorbs the fluid. Okay, so this is the outside layer, this is the inside layer. Outside layer is secreting the pleural fluid, the visceral layer is absorbing the pleural fluid, and in between these the pleural fluid is present. Okay, it is always present. And the visceral layer and the parietal layer, now like I told you, the visceral layer is attached to the lung, the parietal layer is attached to the thoracic wall. Okay, so what will happen if the thorax is expanding? These two layers can separate, right? But they do not separate because of the pleural fluid. Okay, once again I will explain in Hindi. तो मैं ये कहना चाह रहा हूँ कि जो बाहर वाला प्लूरा है जिसे हम पेराइटल प्लूरा कहते हैं, वो किससे अटैच्ड है? वो थोरैसिक वॉल से अटैच्ड है. और अंदर वाला लंग्स से अटैच्ड है. अंदर वाला प्लूरा लंग्स के साथ अटैच्ड है. तो क्या होगा अगर बाहर का थोरैसिक वॉल एक्सपैंड करेगा? मतलब हमने अभी बताया था ना, रिब्स का मूवमेंट होता है, तो थोरैक्स एक्सपैंड करता है, राइट? Thorax expands because of the movement of ribs. So if the thorax is expanding, but the lung is not expanding, what will happen? The parietal and visceral pleura will separate. But this does not happen. ऐसा नहीं होता. किस वजह से? प्लूरल फ्लूइड की वजह से. प्लूरल फ्लूइड क्या करता है? इन दोनों लेयर्स को साथ में रखता है. ठीक है. सो हाउ टू अंडरस्टैंड दिस? फॉर एग्जाम्पल, आपने स्कूल में, in school you must have used this type of slide. Yes. So you have a glass slide and then you have a cover slip. So if it is dry, you can easily remove them from each other, correct? But if there is some liquid present in between them, then it is difficult to remove them. Yes. So this is actually known as hydraulic traction. Hydraulic traction. So if there is fluid between two surfaces, it is difficult to separate them, right? So that's why, because of the pleural fluid, we can say that the parietal and visceral layers stay together. Okay, intrapleural pressure. Once again, intrapleural pressure क्या होता है? हमारे पास लंग के बाहर प्लूरा नाम के लेयर्स होते हैं. ठीक है. और कितने लेयर्स होते हैं? ये 2 लेयर्स होते हैं. उसमें अंदर वाले को हम बोलते हैं विसरल, बाहर वाले को बोलते हैं पेराइटल. ठीक है. इनके बीच में जो प्रेशर होता है, उस प्रेशर को हम बोलते हैं इंट्रा प्लूरल प्रेशर. ठीक है. अच्छा, अब ये इंट्रा प्लूरल प्रेशर क्या करता है? ये लंग को खोल के रखता है, वरना लंग क्लोज हो जाएगा. ठीक है. तो क्या हम चाहते हैं कि लंग क्लोज हो जाए? बिल्कुल भी नहीं. हम चाहते हैं कि लंग ओपन रहे. तो ये कैसे लंग को ओपन करता है? ये एक नेगेटिव प्रेशर बना के लंग को ओपन करता है. नेगेटिव प्रेशर का क्या मतलब? जैसे मैंने समझाया था कि अगर आप एक सिरिंज में ड्रग को डालते हैं, तो आप कैसे उस प्लंजर को पुल करते हैं, तो उसमें एकदम से ड्रग आ जाता है ना? उसी तरह से ये नेगेटिव प्रेशर क्या कर रहा है? ये लंग को पुल कर रहा है और उसको ओपन रखता है. ठीक है. वरना लंग नेचुरली क्या चाहता है? लंग बंद होना चाहता है. लंग एक बलून की तरह है. अगर एक बलून को आप खुला छोड़ दें, तो वो क्या करेगा? वो क्लोज हो जाएगा. ठीक है. तो वही है इंट्राप्लूरल प्रेशर. ये नेगेटिव प्रेशर होता है विच इज फाउंड इन बिटवीन द प्लूरा. ठीक है. अच्छा, लास्ट थिंग स्टूडेंट्स, लास्ट थिंग विच वी नीड टू नो हियर इज द lymphatic pump. What is the lymphatic pump of the pleura? See, so in this pleural cavity, there are some pumps. So what these pumps will do, they are lymphatic pumps. Okay, lymphatic pumps. So they will drain. It's like a drain. Okay. So for example, when you wash your clothes in a washing machine, you have to remove the extra water, right? So similarly, we need some place to remove extra pleural fluid. So that work is done by the lymphatic pump. Okay. So if there is lot of pleural fluid around the lungs, then the lymphatic pumps will remove that fluid, and this will help to maintain the negative pressure. So somebody is saying that the slide is blurred. My dear, it's because of your internet connection. So what you can do, if you missed something, you can come after the lecture using the same link. You can watch this video again, and then you can watch it in good quality. Okay. All right. So the lymphatic pump removes the excess pleural fluid and it helps to maintain the negative pressure. So if lot of pleural fluid accumulates, अगर प्लूरा में बहुत ज़्यादा प्लूरल फ्लूइड जमा हो जाएगा, तो क्या होगा? नेगेटिव प्रेशर मेंटेन नहीं हो पाएगा. ठीक है. देखिए क्या है, प्लूरल फ्लूइड वैसे तो नेगेटिव प्रेशर क्रिएट करता है, बट बहुत ज़्यादा प्लूरल फ्लूइड नेगेटिव प्रेशर क्रिएट नहीं करेगा. ठीक है. सो प्लूरल फ्लूइड इज रिक्वायर्ड फॉर क्रिएटिंग नेगेटिव प्रेशर, बट we don't need so much pleural fluid that the negative pressure is gone. Okay. So if there is excess pleural fluid, we call it pleural effusion. Okay, so let me write it down. It is called pleural effusion. So when you study pathology, when you study internal medicine, you will study about this problem. It is called pleural effusion, which means there is lot of pleural fluid in the pleura. Okay, now, so how much is exactly the intrathoracic pressure, which means the intrapleural pressure? How much is it exactly? So the more lung expansion is needed, the more negative pressure will be there. So what did I tell you? Like, these are the lungs. Okay, and consider that around the lungs we have the pleura. Yes. So what did I tell you? How to expand the lungs? The lungs are expanded with the help of the negative pressure. Okay, negative pressure. So if we want to expand the lungs more, we need more negative pressure. Okay, so this you have to remember, right? Okay, now for quiet breathing, which means the normal breathing, see, I told you there are two types of breathing. There is quiet breathing and there is forceful breathing. Yes. So at the start of inspiration, which means when you're starting to breathe, the pressure is -5. Okay, -5, which means you have not started to breathe. Now you're going to, like I'm talking right now. Now I took a breath. Okay, so when I'm starting to breathe in, the pressure the in the intrapleural space will be -5 centimeters of water. -5 centimeters of water. And at the end of inspiration, it will be -7.5. Now do you understand? What did I say? See, if we want to expand the lungs, okay, so suppose before inspiration, this is the size of the lungs, and after inspiration, this is the size of the lungs. Okay, so what happened? We expanded the lungs, correct? We expanded the lungs, and then the size of the lungs increased. So what did I say? For expanding the lungs, we need more negative pressure. Okay, so you can see the negative pressure increase from -5 to -7.5. Okay, what about forceful breathing? Forceful breathing, see, in forceful breathing, which means you're forcing more air, like I'm breathing normally, but if I'm forcing more air inside, so that is called forceful breathing. And also while exhalation, if I'm exhaling normally, that is quiet breathing. But if I if I'm coughing loudly, then that is forceful breathing, forceful exhalation. Okay, so the negative pressures are different in forceful breathing and the positive pressures are different. I will just explain you. So what did I say? For expanding the lungs, see, for expanding the lungs we need negative pressure. So what kind of pressure will we need to collapse the lungs? Now, for example, the lungs are full. Okay, the lungs are full of air and we want to push it out. So then what kind of pressure will be required? Negative or positive? Please answer quickly. Yes, very good. At least four or five students have answered correctly. If we want to decrease the size of the lungs, so for example, now lungs are full of air and now we want to push the air out, so then we will require positive pressure. Okay, तो लंग अगर खाली है, उसमें हवा फिल करनी है, तो नेगेटिव प्रेशर चाहिए. नेगेटिव प्रेशर से लंग का साइज इंक्रीज होता है. और अगर हमें एयर वापस बाहर एक्सेल करनी है, लंग के साइज को डिक्रीज करना है, तो कौन सा प्रेशर लगेगा? पॉजिटिव प्रेशर लगेगा। ठीक है। सो टू इंक्रीज लंग साइज वी नीड नेगेटिव प्रेशर, to decrease lung size we need positive pressure. Okay, so the first example of negative pressure in forceful breathing is deep sigh. So do you know what is sigh? Sigh is oh, you know, which means you're breathing in like when you are scared, okay, or maybe when you are shocked. Like for example, if I tell you that you know, from now you are getting 1 month holiday from the university. Okay, so that will be a deep sigh. So that is forceful breathing in which you're taking air inside. Okay, so the negative pressure for that. And deep yawn. What is deep yawn? So I don't know how many of you just woke up. Deep yawn will be, you know, when you take a deep yawn after waking up or after you get tired after 6 classes. So that is a deep yawn. In both of these, the negative pressure will be high. It will be how much? Minus 30 centimeters. So you can see here, the negative pressure was only minus 5 and minus 7.5 when you are breathing normally. But when you're doing forceful breathing, in the example of deep sigh and deep yawn, how much is it? It is minus 30 centimeter water. Okay, minus 30 centimeters of water. Now, what is the meaning of minus 30 centimeters of water? It is just a way to measure the pressure. So, just like we use mmHg, right? Millimeters of mercury. So, that is also a way to measure pressure. This is also a way to measure pressure. If you want the details of this, you can go and you can watch it on YouTube. So, that will be a whole another 10-minute explanation. We cannot do that right now. Right now, you just have to remember that the negative pressure will be high when it is forceful inhalation. Also, first cry of neonate. What is the meaning of neonate? Neonate means newborn baby. Okay, so first cry. So the first time the baby will cry, see, the lungs are having fluid. When the baby is inside the mother, the lungs are full of fluid. But when the baby is born, the fluid is pushed out, and now the lungs have to expand, right? The lungs have to expand. So at that time, how much will be the pressure? It will be minus 60. Okay. So just imagine how much pressure I used to fill my lungs in a deep sigh, right? So double of that pressure is used by the lungs of a newborn baby to expand the lungs the first time, okay, after it is born. And the last one is Muller's maneuver. Muller's maneuver. What is the meaning of Muller's maneuver? See, there is a layer called glottis. Okay, let me write that here. Glottis. Now, Muller's maneuver, you will study again, you will study about it in pathology or medicine. You will not study it in physiology, but you have to know about it. So, Muller's maneuver means the glottis will be closed. The glottis will be closed. So, where is the glottis? So, from the lungs, these are your airway, and the glottis will be covering this. Okay. So whenever we breathe, the glottis is actually open. So what happens if the glottis is closed and then somebody is trying to breathe forcefully? So this is not possible. Like if you try, you cannot do it. It is only done in a hospital. So the doctors do some tests. So for that, they will do the Muller's maneuver. Abhi, right now, you just have to remember the number. It will be minus 100 centimeter H2O. Okay, minus 100 centimeter H2O. And similarly, so these were all your negative pressures, which means there is inhalation. inhalation. Right now, we were talking about forceful inhalations. What about forceful exhalations? First of all, can you please give me an example of forceful exhalation where you're exhaling a lot of air out forcefully? Before that, everybody please send me attendance once again because I can see students have reduced once again and I want to catch those students and give them absent. So within 1 minute, everybody please send your attendance. Only 60 seconds. So those 10-15 students who disappeared, they will be absent now. I'm very happy. Wow, suddenly 10 students are back online. See, I know your games. Again, anytime I'm going to take attendance once more. So don't just, you have to sit at home and just you have to understand the lecture. I don't know what's the big deal with that. I don't know why you're trying to run away. इसमें भी चोरी कर रहे हो. घर पे बैठ के लेक्चर देखना है और समझना है बस. Okay, guys. Attendance is over. Again, after 2-3 minutes, I will take the attendance. So, talking about forceful breathing, now let's talk about the positive pressure. Okay. So, the example some students already mentioned cough. Okay. Very good. Cough is one example. Sneezing. Sneezing is also one example. Right? Cough का मतलब खांसी. Sneeze का मतलब छींकना. And what else? We can see yelling and opera singing. Yelling का मतलब होता है चिल्लाना. And opera singing, you know, those singers who are in a big hall and they sing, ah, those kind of singers, they are called opera singers. So they also use a lot of pressure, a lot of positive pressure. And the last one is Valsalva maneuver. Valsalva maneuver. So let me just tell you about Valsalva maneuver. Just like Muller's maneuver, in Valsalva maneuver also, the glottis is closed. The glottis will be closed. Okay. And with closed glottis, the patient will try to forcefully exhale. Okay. Again, this test is also done in the hospital. It is done by the doctor. So you will study more about it later in other subjects, but right now you just have to know that how much is the pressure in all these cases. So for dry cough and strong sneeze, the pressure is plus 30 to plus 50 centimeter of water. For yelling and opera singing, it is plus 60 to plus 80 centimeters of water. And the last for Valsalva maneuver, it is plus 100 to plus 150 centimeters of water. Okay. So these are the values of the pressure. Now the next type of pressure is the intra-alveolar pressure, which means the pressure inside the alveoli. So if you remember, just a second, I will just set that up for you. Yes. So the next type of pressure is intra-alveolar pressure. The first pressure was intra-pleural pressure. This one is intra-alveolar pressure. Okay. So this is the lung, and this was the pleura, right? So the pressure which is here, it is called intrapleural pressure. But if you look inside the lungs, you will find tiny alveoli. Yes. So the pressure inside those alveoli will be called intra-alveolar pressure. So at the start of inspiration, which means when we want to expand the alveolus, the pressure is -1 centimeter of water. And at the start of expiration, which means when we want to push air outside the alveolus, the pressure will be +1. Okay, so very easy to remember, -1 and +1. जब हमें सांस लेना शुरू करना है तो एल्वियोलस का प्रेशर होगा -1। क्यों -1 होगा? क्योंकि एल्वियोलस का साइज हमें इंक्रीज करना है। और जब हमें रिलीज करना है ब्रेथ को, उस टाइम पे वी विल द प्रेशर विल इंक्रीज, तो इसलिए +1 हो जाएगा। ठीक है। ओके। नेक्स्ट वन इज ट्रांसपल्मोनरी प्रेशर। ट्रांसपल्मोनरी प्रेशर। Just taking care of some of our good friends who are in the chat. Okay. Now, transpulmonary pressure. It is the pressure difference between intraalveolar and intrapleural pressures. So, we told you the different intrapleural pressures, right? These are the intrapleural pressures. Just a second. Yes. So, -5, -7.5. And then for forceful, we have different intrapleural pressures, right? -30, +30. And we know the intra-alveolar pressure can be -1 or +1. So transpulmonary pressure means the difference between intra-alveolar and intrapleural. What is the meaning? It means intra-alveolar pressure minus intrapleural pressure. Okay, intra-alveolar pressure minus intrapleural pressure. Okay. So this is the pressure which causes the expansion of the lungs. So the more the lung expands, the more the transpulmonary pressure will increase. Next type of pressure is the transthoracic pressure. See, some things you just have to learn, you just have to memorize. So for transpulmonary pressure, just remember this formula: intraalveolar pressure minus intrapleural pressure. Okay. Then what is transthoracic pressure? So transthoracic is the pressure difference between intraalveolar and external pressure on the chest wall. Okay, so this again, see, this is the lung. Okay, then outside the lungs, what do we have? We have the pleura. Yes, we have the pleura. Then outside the pleura, what do we have? We have the thoracic wall. Yes, so thoracic wall is made up of ribs as well as the intercostal muscles, correct? So ribs and intercostal muscles, they make the thoracic wall. So there is a pressure which is from outside also on this thoracic wall. Okay. So this is called the external pressure on the chest wall. So intraalveolar pressure, which is inside the alveoli, minus the external pressure on the chest wall, it will be called the transthoracic pressure. The transthoracic pressure. Okay. Next is the transmural pressure. What is the transmural pressure? It is the pressure across the wall of the airway. What does this mean, wall of the airway? So, see, in this lung, we have the trachea, we have the bronchi. Yes. So, we have to see what is the pressure across this. What is the meaning of across? Across. The pressure across this means if this is outside and this is inside, outside pressure minus inside pressure, it is called the pressure across that surface. Okay. So pressure across the wall of the airway is nothing but pressure inside the, I'm sorry, not outside minus inside, it is inside minus outside. So pressure inside the airway minus the pressure just outside the airway. So what is just outside the airway? It is the interstitium. So let me draw it once again just to make it clear. So we are talking about transmural pressure. Okay. So what is it? Pressure inside the airway minus pressure outside the airway. So what is the pressure inside the airway? So if this is the lung, this is the airway. So the pressure inside the airway will be the pressure over here. Yes. This is I. I means inside the airway. What about outside? The outside will be here. This is the outside of the airway. And this part is also known as interstitium. Okay. So the pressure difference between the I and O, it is also known as the transmural pressure. Okay. All right. Now, surface tension and surfactant. This is the last thing which we have to study today. So, what is the meaning of surface tension? Before that, everybody please attendance once again because there are 95 students now and I have seen 115. So, 20 students are missing. Those who are asking me to repeat in other languages, I'm sorry, it is not possible. And also those who are saying that you want me to repeat some topic again, so what you can do after the lecture, आप एक बार फिर से देखिए लेक्चर को. ठीक है. अगर आपको तब भी नहीं समझ में आता तो फिर आप मेरे पास क्लास में आइएगा, नेक्स्ट लेक्चर में आइएगा और मैं आपको पर्सनली समझाऊंगा. ठीक है. बिकॉज इफ वी कीप रिपीटिंग नाउ अगेन एंड अगेन तो फिर 12 बजे तक ये लेक्चर चलता रहेगा. वी विल नॉट बी एबल टू फिनिश दिस. ओके. So still we have only 96 students. So 15 to 20 students are going to get absent. Okay, guys, let's start again. So, surface tension and surfactant. First, we need to understand what is the meaning of surface tension. Okay, surface tension क्या होता है? So, every time, whenever there is a liquid and on top of that there is air, there will be surface tension. Okay, so when we look at oceans, when we look at the sea, okay, so what is there is a lot of water and there is a lot of air. Yes. So whenever water or liquid and air will interact, there will be surface tension. So let's try to understand what is the surface tension. So suppose you have some water in a glass, okay, and these blue ones are the water molecules. Water molecules. So the water molecules which are inside, for example, these ones, they have equal forces in all directions. Yes, they have forces in all directions. Why they have forces in all directions? Because suppose if you consider this molecule, so it is having force upwards also, right, left, down, it is having forces in all directions. But these molecules which are on the top layer, they are having interaction only on the side and on the bottom. They are not having the forces in this direction. So what happens because of this? The force in this direction will increase. Okay, so this force will be the forces between the atoms on the top layer of the liquid. They will be high, high amount of forces. So because there are high amount of forces, they will try to come together. Okay, so because of the high amount of forces, these top molecules will try to come together. Okay, they exert extra force on each other, and this is called the surface tension. And because of the surface tension, what happens? The surface will try to shrink, the surface will try to become small. Okay, so that is the simple concept of surface tension. This is actually physics, but I have to tell you because it is important to understand. Yes, it is important to understand the alveoli. So if you are asked the question, how do we measure surface tension, the answer will be stalagmometer, and it is also known as stactometer. Okay, so both names are of the device which is used to measure the surface tension. And how is this related to lungs? Can you tell me in the chat? Can you tell me in the message how surface tension is related to the lungs? Like we are saying that there should be air and there should be fluid, and there should be interaction between air and fluid. So where does this happen in the lung? Air and fluid interaction. Due to breathing. Okay. Surface area of lungs. Uh-huh. Think more. द- किस जगह पे फ्लूइड भी होता है? Yes, I've got the correct answer. Mm-hmm. In alveoli, yes, expansion and distension of alveoli. So the correct answer is alveoli. So in the alveoli, there is a fluid which is called the alveolar fluid, and alveolar fluid creates surface tension. Okay, so let me just yeah, so we can draw the alveolus over here. So this is the tiny alveolus. In this alveolus, there is fluid. Fluid is present in the alveolus, and this fluid is called alveolar fluid. Okay, and it creates surface tension. And what is the meaning of surface tension? What did we tell you? Surface tends to shrink. So anytime there is surface tension, the surface will try to shrink, it will try to become small. So acha, fluid we saw, what about the air? The air is also here. Yes, the air is coming from outside, correct? So, because of this, there will be surface tension, and the alveoli will try to shrink. And what does it mean, shrink? It will try to become small, it will try to collapse. So, because of surface tension, see, the alveoli size can reduce. Okay. So, because of the tension, the size will reduce. And we don't want this. We don't want this. So, what we do for that, that I will tell you. For this, we use surfactant. Okay. So, in the alveolus, there is alveolar fluid, and the alveolar fluid causes the alveoli to shrink, to close. But we don't want it to close. That's why there is a substance known as surfactant. This substance is present in the alveolar fluid. Okay. So, यहाँ पे I drew the alveolar fluid. In the alveolar fluid, there is a substance known as surfactant. This surfactant will prevent the closure of the alveolus. Okay, so someone did not understand surface tension. What we are trying to say, surface tension में क्या होता है कि ये जो मॉलिक्यूल्स होते हैं वाटर के या जो भी लिक्विड है उसके जो मॉलिक्यूल्स हैं, इन पे फोर्सेस होते हैं, ठीक है? तो इन पे हर डायरेक्शन में फोर्सेस होते हैं, करेक्ट? अप, डाउन, राइट, लेफ्ट, हर डायरेक्शन में फोर्सेस होते हैं। लेकिन जो इनकी टॉप लेयर है, इसमें आप देख सकते हैं कि इस डायरेक्शन के फोर्सेस क्या हो गए? मिसिंग हो गए। तो जब इस डायरेक्शन के फोर्सेस नहीं हैं, तो ये आपस में ही ज़्यादा फोर्स देते हैं एक दूसरे को, ठीक है? ये जो ऊपर वाले मॉलिक्यूल्स हैं, ये आपस में जो ऊपर वाली लेयर है, इस पे फिर से ज़्यादा फोर्सेस हो जाते हैं, और वो ज़्यादा फोर्सेस को ही हम बोलते हैं सरफेस टेंशन, ठीक है? उन फोर्सेस को हम बोलते हैं सरफेस टेंशन। और इस सरफेस टेंशन की वजह से क्या होता है, ये जो सरफेस है वो छोटा होने की कोशिश करता है, ठीक है? ओके, ऑलराइट। नाउ हेयर यू कैन सी, ये है यहाँ पे आपका एल्वियोलस, ठीक है? इसमें टाइप 1 न्यूमोसाइट, टाइप 2 न्यूमोसाइट अगर आपको याद हो हमने पढ़ा था। ये यहाँ पे एयर है, और ये यहाँ पे क्या है, एल्वियोलर फ्लूइड है। और ये है एयर लिक्विड इंटरफेस। एयर लिक्विड इंटरफेस मतलब जहाँ पे एयर और लिक्विड मिलते हैं, ठीक है? सो समवन इज आस्किंग दैट, yes, if there is problem with the surfactant, then obviously the lungs and the alveoli will not expand properly. Okay. All right. So what is surfactant? Now let's see the official definition. Surfactant is a surface active agent. मतलब surface पे काम करता है. It works on the alveolar surface. It reduces the surface tension in the alveoli. Okay. And it is present in the alveolar fluid. तो इस स्टोरी में विलन कौन है? एल्वियोलर फ्लूइड, क्योंकि एल्वियोलर फ्लूइड लंग एल्वियोलस को क्लोज कर रहा है। बट एल्वियोलर फ्लूइड में ही सर्फेक्टेंट होता है। ओके, सो विद इन द एल्वियोलर फ्लूइड सर्फेक्टेंट इज ऑल्सो प्रेजेंट, and it will reduce the surface tension. And the question that can be asked is, who synthesizes the surfactant? Where is it synthesized? So the answer is Clara cells and type 2 pneumocytes. See, if you remember in the previous lecture, we mentioned that type 2 pneumocytes, they synthesize the surfactant. But here you have to remember one more cell. It is the Clara cells. The Clara cells also synthesize the surfactant. And the last thing you need to know is that tubular myelin. ट्यूबुलर माइलिन इज द प्रीकर्सर स्टेज ऑफ सर्फेक्टेंट. कभी भी आप ये वर्ड अगर सुनोगे, वेन एवर यू लिसन टू प्रीकर्सर, it means the thing that comes before the mature form. Okay, so if you remember, when we were talking about RBCs, right? When we were talking about RBCs, what was the name of RBC precursor? Can anybody tell me in the chat quickly? In the previous semester, red blood cell precursor, the last precursor just before red blood cell. Yes, reticulocytes, erythroblasts, proerythrocytes, all of these are actually precursors. Okay, all of these are precursors. Why? Because all of these are the immature form of RBC. So they are all precursor, and ultimately they will form the red blood cell. Similarly, coming back to the topic, tubular myelin is the precursor stage of surfactant. तो surfactant से पहले, before the surfactant, what is it called? It is called tubular myelin, and then it converts to surfactant when it is matured. Okay, and the last thing is, what are the constituents of सर्फेक्टेंट, विच मीन्स सर्फेक्टेंट के अंदर कौन कौन सी चीजें होती हैं, विच थिंग्स आर प्रेजेंट इन द सर्फेक्टेंट. सो द आंसर इज, फर्स्ट इज DPPC. इट इज डाईपाल्मिटोइल फॉस्फेटिडिल कोलीन. डाईपाल्मिटोइल फॉस्फेटिडिल choline, DPPC. This is the first thing, and this is the majority. This is the majority constituent. Next is surface apoproteins. So surface apoproteins, they are a type of proteins. These are also present in the surfactant. ये क्या करते हैं? They regulate the turnover. Turnover का मतलब क्या होता है? Turnover means how much surfactant is being created and how much surfactant is being destroyed. So we want to control, we want to regulate, right? You remember we talked about in homeostasis, we talked about regulation, right? So body regulates the temperature, regulates the blood pressure. Similarly, the body will regulate the surfactant production and degradation. So which protein does that? Surface apoproteins. They will regulate the turnover. What about the last is the calcium ions. Okay, so calcium ions are also present in the surfactant. And what is the function of these calcium ions? See, so this is the alveolus. Okay, in the alveolus we have the surfactant. Okay, and this surfactant has to be expanded in the whole alveolus, है ना? So we cannot keep the surfactant in one place, right? We want the surfactant in full alveolus. So this calcium ion helps in spreading the surfactant on the complete alveolus. ठीक है, तो एल्वियोलस के अंदर एक जगह पे सर्फेक्टेंट हमें नहीं चाहिए, पूरे एल्वियोलस में फैला होना चाहिए. तो उसमें कौन हेल्प करता है? वो कैल्शियम आयन हेल्प करता है. ठीक है, and what are the functions of surfactant? This is the last thing. Again and again I'm saying this is last, but ये actually last है. Functions क्या हैं? It reduces the collapsing tendency. ठीक है, so हमने क्या बोला कि सरफेस टेंशन की वजह से, बिकॉज ऑफ सरफेस टेंशन, द एल्वियोलस वांट्स टू क्लोज. एल्वियोलस बंद होना चाहता है. तो उसको कौन रोक रहा है? सर्फेक्टेंट रोक रहा है। तो फर्स्ट फंक्शन इज इट रिड्यूसेस द कोलैप्सिंग टेंडेंसी। अच्छा, अगर कोलैप्स नहीं हो रहा है, अगर बंद नहीं हो रहा है, तो क्या है? ओपन है, करेक्ट। अगर ओपन है, उसी को बोलते हैं डिस्टेंसिबिलिटी। ठीक है, डिस्टेंसिबिलिटी। तो डिस्टेंसिबिलिटी को इंक्रीज करता है, एल्वियोलाई को ड्राई रखता है। सरफेक्टेंट जो है वो एल्वियोलस को ड्राई रखता है। कैसे रखता है वो हम बाद में डिस्कस करेंगे। राइट नाउ जस्ट रिमेंबर दैट सरफेक्टेंट कीप्स द एल्वियोलस ड्राई। ओके, चलिए मैं आपको बता देता हूं कैसे होता है। सो दिस इज द एल्वियोलस, ओके, एंड सपोज दिस इज द सरफेक्टेंट, राइट। सो व्हाट आर वी सेइंग? सर्फेक्टेंट हमें क्यों चाहिए? एल्वियोलस को ओपन रखने के लिए। वी नीड द सर्फेक्टेंट टू कीप द एल्वियोलस ओपन। इफ द सर्फेक्टेंट इज नॉट देयर, what will happen? The alveolus will close. Okay, and if the alveolus will close, यहाँ पे आसपास आसपास जो भी वाटर होगा वो एल्वियोलस के अंदर चला जाएगा। ठीक है, so if there is no surfactant, alveolus will close. If alveolus will close, it will accumulate fluid from around itself, and that's why surfactant is required to keep the alveolus dry. Okay, and the last thing which is mentioned is, what does the surfactant do? It stabilizes interdependence of alveolar system. This we will see in the next lecture. Now, once again, everybody send your attendance. Right now, there are only 90 students. And after you send the attendance, you can close the video and you can enjoy. Okay, students, goodbye. Thank you.